Do not just read those success stories of the different successful people, but create your own stories. That is the name of the Steve Jobs, one of the very famous man and successful man. Now, coming to the types of the scabies, there are three types of the scabies. Number one, classical scabies. Number two, Norwegian or crested scabies. And number three is the nodular scabies. First, we are going to discuss the classical scabies seen in the people with the normal immune system. The mite burrows in the webbing between the fingers, flexing surface of the wrist and around the elbow, armpit, knee, penis, area of the breast, shoulder blades, belt line, and the lower buttocks. It spares the neck and head, but not in case of the infants, but only in adults. Main symptoms are itching and rash. Rash and itch are also away from the location of the mites. And here one can see the lesion in web of the finger, then flexor surface of the wrist, that is being transmitted when one do shake the hand with the other, around the elbow, and in the armpit, in the knees, and in the penis in case of male. Similarly, it can be at the areola of the breast, around the areola of the breast, and here one can see the shoulder blade, and here the belt line, and the buttocks and the legs. These are the most affected part, and one can see clearly the lesions here. Now, the itching is due to an allergic reaction to the tiny mites. It is worse at night because of the distraction and after the hot bath. Rash is blotchy red due to the superficial burrows, and the mite tunnels or the burrows on the skin are linear or S-shaped track in the skin, and these are about 2 to 10 millimeter long. Scabies always affect both sides of the body, giving a symmetrical pattern of the rashes. It starts at the hand and spread to the other parts. First infection, the symptoms appear 2 to 6 weeks, and in the second infection, symptoms appear within 24 hours. And it is often seen in other family members also. So here one can see the itching and the scabies, and there are the scabies burrows, which are the point of the mites, as one can see, and here there is the bumps and the blisters and the mite burrows that can be, and the rash because of the mite, and one scratches from the severe itching that can lead to the superadded bacterial infection also. Now, a tiny mite may be seen at the end of the burrow in case of the classical scabies. Scratching causes skin breakdown and superadded bacterial infection, I have already told you, and it leads to the open sores that become impetigo due to the Streptococcus pyogenes or Staphylococcus aureus infection. Sometimes there are atypical presentation, that is in case of the infants, eruptions is generally vesicular and bully, that is filled with fluid or the pus, so that is called acropustulosis. Acro is the word used for hand, or blisters and the pustules on the palms and the soles of the feet, seen in case of the infants. Eczematous eruptions and urticaria, eruptions of the itching wheals, that is also seen. So here one can see in case of the infant, the kind of the lesion like vertigo, and that is acropustulosis, and one can see the bully filled with the fluid, and it is the pus filled lesions also. Now, classical sites of the scabies rash are, as one can see, in the armpit, the flexor surface of the arm, inguinal area, belt line, buttocks, and palm of the hand. These are the most common and classical sites. Now, coming to the second type of the scabies, that is Norwegian or crusted scabies. It is also called hyperkeratosis scabies due to the generalized hyperkeratosis. It was described in 1848 by a Norwegian Daniel Sen and Boyk. These were the two persons, those who discovered this. They do not show characteristic rash and itching, and it is severe, overwhelming scabies infestation in people with a weakened immune system, and in elderly debilitated patients, disabled patients with the Down syndrome, and there is impaired antibody response in the individuals infested with the thousands to millions of the scabies mites. They produce grey, thick crust, scaly plaques spread over host body except the face. These were the person, Danielson and the boy who discovered all this scabies. Continuing the Norwegian or crusted scabies, it is mainly on the hands, feet, scalp, and other pressure-bearing areas except the face. Mites living in the detached crust can live for a week without a human contact. So eradication of the mite will become difficult as the crust protects the mites from topical miticides or scabicide medicine. Patient is highly contagious and spread rapidly, but mites here are less virulent than in case of the non-crusted scabies or classical scabies. Oral ivermectin is the treatment of choice combined with any topical treatment. And here one can see the Norwegian or the crusted scabies, and there one can see the crust and the plaques. That is because of crusted scabies. Now, the third variety is nodular scabies. There are small, red-brown, intensely pruritic nodules, usually on the penis, scrotum, groin, and axilla. These nodules are pathognomonic of the scabies infection. It is in response to the dead mite antigens and the feces of the mite. It can persist for weeks and months after effective treatment. So here one can see the nodular scabies on the penis, on the scrotum, and in the underarm, and then this scabies nodular with the secondary infection bacterial leading to the impetigo. So that is all the presentation of nodular scabies. Now, the diagnosis of the scabies, there are two methods, parameters. One is history and the physical examination, and number two is microscopic examination. Number one, history and physical examination. It is seen clinically in area where it is very common, rash and intense itching or the pruritus is there, and infant irritability during sleep is noted, and history of the involvement of the other family members and the contacts is also positive. There is, one can detect typical lesion in a typical distribution as I have already shown you, that is called the clinical scabies, or one can have atypical lesion in atypical distribution, that is suspected scabies. Now, the diagnosis number 2 is microscopic examination. Definitive, definitive diagnosis is by the direct visualization of the mite, eggs, or the feces of the mite from the burrows. Take the sample from the skin scraping, papules, or intact burrows and see the mite or the eggs, and under potassium hydroxide preparation, put the mineral oil on one end of a burrow and then scrap with number 5 scalpel blade. If result is negative, diagnosis is not negative. In suspicious area, put the fountain pen ink or typical tetracycline solution, which will glow under a special light. So here one can see, one can take the sample from the web of the fingers and put the ink to see the burrows, and also one can see the burrows by putting the ink, and then under the microscope one can see the mite or the eggs of the mite to confirm the diagnosis. Here are the burrows of the scabies, that one can see the S shape of the serpentine, and here also the burrows, and these are the burrows, and burrows are because, as I have told you, that is because of the female gravid which put the eggs, lay the eggs in these tunnels, and that makes the appearance of the burrows. So here one can see the beautiful photography of a photographer and the idea of the photographer. It is really remarkable. Now, the differential diagnosis of the disease is impetigo, insect bite by the lice and the fleas, drug eruptions, chickenpox, varicella, syphilis, erythema multiforme, urticaria, and eczema. Here one can see the impetigo, that is a bacterial infection, and one can also appreciate flea bites on the human skin, and where there are drug reaction due to any drug which is just not suitable to a person, and that cause the drug reaction. And these are the typical chickenpox rashes, that is with the fluid, and that is the crop of the chickenpox which is filled with the fluid. And here one can see the syphilis lesions on the hands, on the different part of the body, and that is the urticaria, and that is the eczema, which is just mimicking with this disease. Now, coming to the treatment, treat the patient and his family members and the sexual partner, because they are supposed to spread it to the different healthy people, and treat at the same time to prevent the reinfection. Treat everyone who have close prolonged contact to the infested person, and the treatments are of 2 types, topical and systemic. First, the topical treatment. 30 grams of the cream or 100 ml of the lotion is sufficient to cover the whole body. Lotions are better than the creams because of the better penetration to the site of the mite, especially to the areas primarily affected, that is skin folds, hands, etc., except the head and the neck. Coat the entire skin surface. Any skin surface or the patch that is left untreated, that provides a safe haven for the mite. So try to cover the whole area just to avoid the evasion of the mite. Now, permethrin, chlorotoluene benzyl benzoate, sulfur ointment, malathion, ivermectin for sarcoptic dengue, which infects animals, and linden creams are used topically. If symptoms continue for 2 to 4 weeks following treatment, do the retreatment with the topical medicines. Put the mittens on babies to avoid licking cream or lotion off their hands to the mouth to have the poisonous effect of the medicine. Do not apply treatment after a hot bath as this increases systemic absorption of the topical medicine. Trim the fingernails and the toenails, apply under the nails. If hands washed, reapply the treatment. And effective treatment means no new burrows or rashes appear 24 to 48 hours after the treatment. Now here one can see the permethrin cream, clotamidine cream, benzyl benzoate ointment, and that is the sulfur skin ointment which is used topically for the different cases. And similarly, malathion lotion and ivermectin cream and linden cream are also in use. Now, the second part of the treatment is systemic treatment, ivermectin, single dose orally in the form of injection, and the lotion for mainly crusted scabies is being used. It can be combined with the topical agents and ivermectin systemically. A single dose of 200 microgram per kg body weight is given, and it can be repeated after 14 days. Steroids should be avoided as it weakens the immunity, and intrarenal steroids may resolve erythematous nodules and they are of some help. Antihistamine will definitely reduce the itching, so that is symptomatic treatment. Similarly, anti-inflammatory reduce the inflammation. Antimicrobials are sometimes given topically or systemically to treat the secondary bacterial infection. And here one can see the ivermectin 3 milligram tablet and ivermectin injection, and where one can see the intrarenal drug of steroid, and that is the antihistamine for pruritus and the antibiotic for secondary bacterial infection. Sometimes there is treatment failure if there is incorrect diagnosis of the scabies or reinfestation from the patient or the fomites of the crusted scabies patient, or resistance to the medication by the faulty application of the topical scabicides, and failure to have second application when needed. Crusted scabies have poor penetration of the scabicide into the thick scaly skin, so that can lead to the failure of the treatment. New burrows appear after the treatment, and retreat all the members of the household and close contact simultaneously. And here one can see the crusted scabies before and after treatment if properly applied medicine and given medicine. Now, how to prevent the disease? Bedding and clothing used in the last 3 days, wash in the hot water and dried in the hot dryer, so that one can kill all the mites present there, as the mite does not live for more than 3 days away from the human skin or the true host, so no more washing is needed. Vacuum the carpets, mattresses, upholstered furniture and the vehicles. Mass treatment with the topical permethrin or oral ivermectin of close contacts or sexual contacts, even if they are asymptomatic. No vaccine is available for the scabies, and people with the crusted or Norwegian scabies and their close contact their rooms must be treated aggressively to avoid the outbreaks to so that is the end of the scabies. I have given as much as possible the best for the scabies, and I think you will not need to consult any other book after having my this lecture. And if you like the lecture, please subscribe my channel and share it to others and like it. If you have any question regarding this topic, you can call me at my numbers anytime. Thank you to be with me and watching the lecture. Thank you.